Many older adults are convinced to join Medicare Advantage because of the $0 price tag without realizing they might lose access to their doctors or face delays in care. We hear it all the time. People call us needing care, but their plan does not cover the advanced wound treatments we provide. These are patients who want to heal, but their insurance rules stand in the way. What they don't tell you is that free can come with hidden costs, limited doctor networks, delays in care due to prior authorization, rules that can change every year. The good news? You can have traditional Medicare, keep your choice of doctors, avoid the red tape, and still pay zero for premiums, deductibles, and most copays if you qualify for a program called Qualified Medicare Beneficiary or QMB. QMB is run by your state's Medicaid program, but you don't have to be on full Medicaid to qualify. Even if you've never had Medicaid before, you might still get QMB to help pay your Medicare costs. If you qualify, QMB will pay your Medicare Part A premium. If you have one, most people don't. Pay your Medicare Part B premium, cover all Medicare deductibles, co-pays, and coinsurance so you don't pay the usual 20% out of pocket. If you also qualify for extra help, which many QMB recipients do automatically, your Part D prescription drug premiums, deductibles, and most co-pays are also covered. See if you qualify by calling Texas Health and Human Services at 211 and ask about the QMB program. Then visit the Texas HHS Medicare Savings Programs page to apply. If you're not sure where to start, call us at Integrity Wound Care. We can help point you in the right direction.